Welcome to the training on wound care, to equip caregivers with the knowledge and skills necessary to manage and care for wounds effectively, promoting healing and preventing infection. Proper care of wounds is crucial to prevent infection and promote healing. This session will guide you through the best practices for managing various types of wounds. Identification. Wounds can vary significantly depending on their cause and location. The most common types include surgical wounds. These are clean incisions made during surgeries that require careful monitoring to prevent infection. Pressure ulcers. Often seen in bedridden care recipients, these wounds result from prolonged pressure on the skin. Diabetic ulcers. These are open sores or wounds that occur in diabetic care recipients, typically on the feet, due to poor circulation and nerve damage. Cleaning and dressing. Maintaining strict hygiene is crucial in preventing infections. Wash your hands thoroughly before and after wound care. Use sterile gloves and ensure all instruments and dressings are sterile before use. The first step in wound care is thorough cleaning. Use sterile saline or a prescribed wound cleanser to gently clean the wound. Always clean from the least contaminated area to the most contaminated, typically from the center of the wound outward. This method helps prevent introducing bacteria into the wound. Infection prevention. Recognizing the early signs of infection is critical. Look for increased redness, warmth around the wound, swelling, pus, or a foul odor. The care recipient might also experience increased pain or fever. Changing dressings. Selecting the appropriate dressing is essential for wound healing. The choice depends on the wound's location, size, and the amount of exudate or fluid. Options include gauze dressings, good for wounds with minimal drainage. Hydrocolloid dressings, ideal for wounds with moderate drainage, promoting a moist environment that supports healing. Foam dressings, useful for wounds with heavy exudate, providing excellent absorption while protecting the wound from further damage. When applying a new dressing, ensure that the wound is clean and dry. Place the dressing gently over the wound without stretching it and secure it with medical tape or a bandage. The dressing should cover the wound completely and be changed according to the healthcare provider's instructions or when it becomes saturated or dirty. Pain management. Assess and document the care recipient's pain level before, during, and after wound care procedures. Provide appropriate pain management options such as topical anesthetics as ordered by a healthcare provider. Documentation and communication. Report any changes or complications related to the wound to the healthcare team promptly. Thank you for completing the wound care training. Effective wound management is essential for care recipient recovery and comfort. Your diligent care and attention to detail can significantly impact healing outcomes.